I'm a cosmetic surgeon. I've been in practice for about 11 years. I limited my practice to cosmetic surgery, and we do facial, breast, and body cosmetic surgery. I was attracted to the cosmetic part because it really transformed the patients. And so life brought me out to Rancho Cucamonga, California, and I've been here since. I'm lucky to have a very good practice. I have excellent patients. Most of the patients that come into our practice just basically want to look or feel better, and they have a certain area that bothers them, whether it is someone in their 30s after having a few kids and they undergo the changes in their body. They have some atrophy in their breasts, and they don't feel quite as feminine or attractive, or they have some loose skin on their abdomen or excess fat in their hips from the retained blood from pregnancies. Those are the typical patients, and so we can offer them liposuction for contouring of their body. Sometimes they need a tummy tuck procedure, and sometimes they need an augmentation procedure, whether it is with implants or fat grafting. So we offer all of those. In addition, we do a lot of minimally invasive procedures, such as the belly button breast augmentation, endoscopic brow lifts, and mid-face lifts. So we're cognizant that the patients want to have as quick of a recovery as possible. And so using minimally invasive procedures makes it conducive for the patient to have the procedure and just have a few days or a week of recovery and go back to their normal routine. So I think patients are very savvy these days. They look at the technology, they look at what's available. Nowadays we can extract some regenerative cells and pluripotential stem cells from the patient's own fat, and then we can mix it with their own fat to do the augmentation. That can potentially increase the survival of the fat cells and take the graft much better. So the process of doing fat grafting for buttock augmentation or breast or facial augmentation would be a simple procedure whereby we inject local anesthetic, a very dilute solution of local anesthetic, into a fat compartment, for example, the abdomen or the thighs or the hips. And then with liposuction, we can extract the fat cells, and the fat cells have some mesenchymal stem cells in them, and then we can separate by a special technique of a process where we remove the excess fluid and then spin some of the stem cells out. We can isolate those pluripotential cells and then add those to the pure fat that we're going to inject back into the buttocks or the breast or the face. The advantage of adding regenerative cells to the fat grafting is that those cells can potentiate angiogenesis, which means they can potentiate more blood vessel production to the graft. They can also release some cytokines, which are some chemicals that can induce healing and reduce inflammation. So combining those different effects together, it can potentiate the actual graft and make it last longer. So instead of having a 50% survival and needing another procedure to get it to 70 or 80%, we may get survival of 70 to 80% with our first fat graft. And one of the nice things about using this technology is that we can do the whole procedure pretty much under local anesthesia with just tumescent anesthesia and very little, if any, sedation. And that's appealing to a lot of patients that do not want to undergo general anesthesia. So we're able to do liposuction, process the fat cells, and re-inject them in the same session, and patient is fully awake during the entire procedure, and that's appealing for the patients. For the patient, it translates into a procedure that is fairly simple and done in one session